16 drug dealers are off the streets of Collier County and South Florida. That's a very positive thing. I can tell you that there are more to come, and as we sit here right now, we're in the process of trying to pick several more up. They are off the streets for trafficking in heroin, conspiracy to traffic heroin, and methamphetamine. And you know, throughout the nation, from Vermont to California to Florida, heroin is a growing trend. And unfortunately, because we've done so well, particularly in Florida, managing our pill problems of the last several years, the access and the low cost of heroin is making that, unfortunately, a drug of choice for the future. The Collier County Sheriff's Office Vice Intelligence and Narcotics Unit has always been very proactive in whatever the trend of drug type is, and they are that way in this case. While we don't have a significant amount of heroin yet throughout Collier County, our investigators identified the fact that it was increasing in amount as they were completing their investigations, and that's what really started to ramp up this nearly 1 year long investigation. Today, with the help of the State Attorney's Office, and we have Assistant State Attorney Collier here, Kate Rumley, along with the DEA in Miami, the Miami-Dade Violent Crimes Task Force, the Monroe County Sheriff's Office, all working together have put together arrests, seizures, and will outline for you what some of the impacts to our community are and will be, as well as follow-up. As part of that follow-up and an element that our Vice Intelligence Narcotics Unit put in place over the last year with regard to substance abuse and trying to get those who have become victim to it off of it. We are working together with the David Lawrence Center. We have Scott Burgess here with us today. And we're going to talk a little bit about what has been started and where we're additionally going with follow-up. And that follow-up will include a partnership with all of our fire rescue departments, and I'll touch on that a little bit, and our EMS department, and we have Chief Kopka with us here today. So if we look at arrest information, we have currently seized cash, currency, vehicles, firearms, and narcotics. And you can see to my left, in addition to those 16 I mentioned that have been arrested thus far, and those who are yet to be arrested, you can see some of the seizures, and they include, now this is just today, we'll talk about the investigative information, 576 grams of heroin with a street value of $60,000, 513 grams of oxycodone with a street value of $85,000, 3 vehicles, 10 handguns, 1 rifle, $43,000 in cash, and over $7,000 in rounds of ammunition. That is becoming more critically important for law enforcement. As you can see, the picture of the handguns and rifles, in almost every contact we have, criminal contact in the public, whether it be drugs or not, we're finding firearms. And in fact, this past week, we've had 2 incidents where we found an AR-15 as well as handguns. So it's becoming more and more dangerous. When you work in VIN, it only becomes even more critically important to know who you're dealing with and what you're dealing with. And here clearly are some of the people that we are dealing with. Of the 16 involved in this case, most are major drug traffickers. And that is exactly where the Vice Intelligence Narcotics Unit wanted to go. To remove those individuals selling drugs to the residents of our community, our county, and all of South Florida, because it's posing other related crime problems, as we all know, with drug and substance abuse. If we get into the specifics of the cases under investigation, 16 ounces of heroin were purchased for $60,000 during the investigation. There was a conspiracy to traffic 33 kilos during that investigation. If that were allowed to have continued, and these individuals not removed from our streets, that could result in more than 330,000 dosages of heroin out on the streets. And if they cut that, they could almost double that amount of dosages, and at a value of $2.6 million. So when we're talking about taking this many people off the street, we are talking about significantly impacting the flow of heroin and methamphetamine to the residents of Collier County in South Florida. That is a very, very significant impact. And I will tell you that from the time I've been here, and I was in Vice Intelligence Narcotics in the 1980s, this is absolutely the most significant heroin case that has been worked that I'm aware of. If we look at the individuals who have been arrested, there are two primary charges. Not each individual was charged with both charges, but they each have one of trafficking in heroin and or conspiracy to traffic in heroin and or cocaine. I'm not going to read through the names of each individual case, but I will tell you that with the significance of the arrests, the bails that have been set thus far range as high as $2.5 million. And we'll be able to give you more information on that as we go. That just goes to show the significant element of crime activity, both as assessed by the state attorney's office and through the court system. With that in mind, a couple of new things that we're looking at. One is, in going out and taking this many people off the street at one time, there are going to be community questions, community concerns. There are going to be individuals that can no longer supply their drug habits. And so we're going to do something a little bit different this time. And we're going to continue to do this as we move forward. And it's something that I don't think a lot of organizations do following the arrest. Typically, you do a terrific investigation, year long, you make your arrest, you walk away. We are not going to do that. And in fact, we are partnering and have partnered already with the David Lawrence Center and Scott Burgess. He has had some of his staff, along with our detectives, once investigations and warrants have been served, scenes have been made safe, representatives from David Lawrence come in to assist us in referring people at those locations who are not arrested but have drug problems a way to find a way out of those drug problems. Because the more of that we can do in this community, the less potential for increasing crime in the future. And that is a significant plus. And I'll ask Scott before we leave if he would like to make just a comment relative to the relationship we have formed here in Collier County and what that's like in the rest of the country, because he's had a lot of experience throughout. I think we're in a very good spot, and I think we're one of the few organizations that do that. In addition, we are going to work together with our patrol units, with our set patrols at night, and rather than leave neighborhoods, we're actually going back into the neighborhoods tonight and for the next 3 to 5 nights. One, to answer any questions of the public relative to what has occurred, reinforce law enforcement in those neighborhoods so that the sale of drugs doesn't restart with other individuals. And as we're going through the neighborhoods and knowing that there are going to be people who are now no longer able to cope with the lack of drugs, we're going to work with Fire Rescue and Collier County EMS. And I've talked to each of the fire chiefs in each of the districts in Collier County today. I've made them aware of the potential increase in medically related calls due to the stopping of this inflow and sale of drugs in Collier County, and how we might be able to refer those individuals and assist them. If it's in an emergency manner, obviously EMS and Fire Rescue will take care of those problems. For those individuals who are not at that point, we are going to work with directly with David Lawrence, and we have received from David Lawrence brochures and information which we're going to provide to all of our members on the set teams and patrol tonight. And as importantly, we are creating a business card size referral card which we are going to distribute throughout the neighborhoods so that we can get people the help that they need. So we're looking at a very comprehensive start to finish program to enhance public safety in Collier County. And we're going to continue to do this in the future.
The 16 people that were arrested today have already been charged by the state attorney's office with the crimes that the sheriff said, and the state attorney's office worked in conjunction with the County Sheriff's Office and the other agencies throughout this entire investigation.
I first of all just want to say thank you to Sheriff Rambosk and the Collier County Sheriff's Office. As Sheriff Rambosk was just alluding to, across the nation we have struggled as a nation to have law enforcement and mental health and substance abuse providers working collaboratively together. And I have to commend Sheriff Rambosk for his leadership and the leadership here in Collier County relative to making those collaborations work. Since 2008, the Sheriff's Office and the Sheriff himself have supported crisis intervention training, which is where mental health and addictions related symptoms are taught to law enforcement personnel, and we try to look at deflection and diversion opportunities, and that has made a huge difference in this county and really has led the nation as far as a model to follow. We commend the sheriff and the work that's being done here related to the heroin epidemic that's happening nationally in the country. Heroin is now the leading presenting drug or opiates, are the leading presenting drug at David Lawrence Center in the detox program and substance treatment program. It just surpassed alcohol, and we are very concerned about this. Nationally, we know that heroin overdoses are growing exponentially. So this is a very proactive measure in order to take the heroin off of the streets, as well as to navigate individuals into treatment as a preferred option. So we are so thankful, and we really appreciate everything that you're doing. Thank you.
Thank you.
I also would like to thank the sheriff and all of his team members for the hard work and dedication to improve the life and safety parts of Collier County. This is a lot of hard work on his end and his staff, and we certainly appreciate that. How this affects emergency medical services is amazing, simply because the numbers show that we've had a 25% increase in the number of overdoses of drugs and alcohol, or a combination of both of those, from January 1st through August 31st for the same time period last year. And we've had nearly a 50% increase in the use of Narcan for the same time period. Narcan is the medication that we give to these opiate overdoses, and for EMS to increase that amount of usage by 50%, that truly shows that there is an issue with patients that use opiates, and us having to change that medication that's in their body and their system. So I commend him and his staff for his work, and Dave Lord, Senator, and the County Attorney and State Attorney for the work that they do. Thank you.
On these particular houses, a lot of times the narcotics are not used there. Sometimes they are, sometimes they are not. And what's really dangerous, to dovetail into the helping people here, is would you call police to that house if you were overdosing, or do you throw them in the car and take them somewhere else? And that's the problem we have. We want you to call EMS immediately if you're having a medical issue. We want you to be comfortable that your medical issues are going to be taken care of, and I can assure you that EMS is not worried about enforcing the narcotics laws. They're worried about saving your life. And that's a very good question. And we find that a lot, where they will actually move the car, drive into an emergency room, which I will tell you is way too much time, rather than call EMS to those situations. So I would implore people that if you find yourself in that situation, call EMS from where you are. Worry about the rest of it later.
Thank you very much for coming. We appreciate it, and we're going to go out and make contact with the community. Thank you very much.